Hello friends. So today we'll discuss up another important topic, that is the UTI. Okay, and definitely you will have this question in your exam regarding the UTI. Okay, it might be a short note or it might be a long question also. Sometimes they can give it a long question because it have its significance as per the microbiology, because in the UTI the AST, antibiotic sensitivity testing, does play a wonderful role, and you could able to get the required antibiotic as per that. Okay, so we'll go what is UTI first of all, and what are the organisms, what are the various factors, which particular gender affects more, what is the prevalence, with age what happens, what increase, all sorts of things we'll discuss up in the best possible manner so that you can recapitulate in your exam. Okay guys, first of all, this particular case scenario which you might get in your exam also, and try to see up the important points which are there in this. Now, first of all, if you see a 21-year-old female visited up a obs gynae specialist with complaints of what? Burning micturition. And there is an increase in the frequency of urination. That is their frequency have increased up. Along with that, the examiner can add off like dysuria, difficulty in urination. That is there. Okay, urgency is there, could not able to hold up the urine. So all these particular important points, if you are getting up in your like case scenario, you should not be like wasting up your time in analyzing other things. This is UTI. Okay, this is what is UTI, urinary tract infection. Important is, let's see the other things which are there in this question. The urine analysis shows up more than 50 WBCs per high power field. That suggests that this is an infection, that these particular WBC numbers, they are also increased up in the urine. Inflammation is there. Bacteria, they are also observed. Means the bacterial load is such that it is also seen up in the urine. The urine culture is positive for how much? More than 10 to the power 5. And what is this 10 to the power 5? This is the colony forming units. CFU stands for what, guys? Colony forming units per ml of urine. Okay, obviously per ml of urine, this particular colony count was observed per ml of urine. Now, in this particular culture, what they are getting up? Lactose fermenting gram-negative bacilli. Okay, lactose fermenting gram-negative bacilli. Why it is important to know about the lactose fermentation and gram-negative bacilli here? Because UTI is mostly done by these two fellows. Which one? One is E. coli and one is Klebsiella. Both of them, they are gram-negative members. They are gram-negative bacilli and they are lactose fermenters. Belongs to which family? Belongs to the Enterobacteriaceae. Okay, so this sort of a clinical scenario, if you get in your practice, or if you get in your second year exam, we are talking about the professional exams, diagnosis of yours is very clear that we are talking about UTI. Okay, but guys, important is lower UTI or upper UTI? The answer to this particular question is what, guys? Lower UTI. Okay, mostly in the clinical scenarios, what you get? Lower UTI only. Okay, mostly in the clinical scenarios, what you get? You get lower UTI only. So again, I am repeating up, if these types of complaints are being written off, increased frequency is there. Okay, along with the burning micturition. What is burning micturition? There is a, like in Hindi, if you call it jalan. So that particular one is there. So there is a burning while passing of the urine, and there is an increased frequency, urgency, dysuria. These types of words also you can observe in the question. Okay. And when the urine analysis is being done, you can find out the WBCs, and obviously above the 8, they say 5 to 8, they say it is significant, and here it is 50, so obviously very significant. Bacteria are also seen, means the bacteria are also coming in the urine, means the bacterial load is high. And that's why when you go for the urine culture, more than 10^5 CFU per ml of urine that is being observed, and that too of which one? Lactose fermenting gram-negative bacilli. Means either it is E. coli, either it is Klebsiella. Mostly it is E. coli because That is what is the most common cause of what? UTI. Which UTI? Upper or lower? Lower UTI. Okay, upper or lower? That is the lower UTI. Now, if you want to ask anything, you can ask in the comment section also. So I'm available there in the live chat. If you are there, then definitely you can ask up in that particular one. Let me check. Okay. Hi, good evening. So you can ask up if you are in anything confused. So later on at the end of the lecture, I will tell you. Okay. Now, so this confusion of yours that what is lower UTI, what is upper UTI, that is important first of all. You should know this difference. Without that, you will always remain confused that what is lower UTI and what is upper UTI. Now, so first of all, this particular one, this particular picture correctly describes up what is upper urinary tract and what is lower urinary tract. Fine. So as you can see, the lower urinary tract involves up this. That is the bladder along with the urethra. Okay. Along with the urethra, the anatomical structure, if you say with bladder and urethra, that is lower urinary one. The bladder inflammation you call cystitis. The urethral inflammation you call urethritis. Is it fine? And in the upper urinary tract, what you have? You have kidneys. Fine. Along with the ureters. Okay. Along with the ureters. So this is important to know that what is upper urinary tract and what is lower urinary tract. Is it fine? Upper and lower. Now, besides this, if somebody asks us that what is the definition, define UTI. So guys, the definition of UTI is what? It is defined as a disease caused by the microbial invasion of urinary tract that can extend from where to where, guys? Just now we have seen from the kidneys to the urethra. Yes or no? So, which part of the kidney is being considered? The renal cortex. The renal cortex that is there to the urethral meatus means the opening through which the urine comes. So, this is what is the scientific definition of UTI, which you should know. Is it fine, guys? So, again, I'm telling you, UTI is defined as what? UTI is defined as a disease caused by microbial invasion of what? Urinary tract that extend from where to where? From renal cortex of the kidney to the urethral meatus. First of all, this should be remembered. As you can see, the UTI is one of the leading causes of morbidity and the healthcare expenditure in persons of all ages. Okay, in persons of all ages. And here only I like to tell that this is one of the second most common infections in the community and the first infection in the nosocomial stuff. Means in the hospital acquired, if somebody asks you which is the major infection, that is the UTI. And in the community in which we live, in that if somebody asks, this is second most common. So this can also be asked in your viva that which is the most common in the hospital. In the most common hospital, UTI, nosocomial one. So most common nosocomial infection as such is what? UTI. And in the community, the most common infection as such is RTIs, that is respiratory tract infections. Second most common is UTI. So this particular thing also should be remembered and typed in the memory for the future. Just now I told you, as per the anatomical configuration also, lower UTI and upper UTI. Depending on the anatomical sites involved, you can divide up lower and upper. We already have told lower is bladder and the urethra, and the kidneys and the ureters, they come in the upper. Then you can classify in the basis of infection also, like healthcare associated means if somebody is catheterized for some particular region, suppose somebody have undergone surgery or somebody have undergone some trauma or anything else, catheterized for any reason. So that is termed as what, guys? COTI. And what is COTI, guys? COTI is catheter associated UTI. Catheter associated UTI. And another one I just told you, that is the community acquired. The community acquired is, in the community I just told you what? Second most common infection. And in the healthcare one, that is the nosocomial, the first. So if somebody asks you which is the most common nosocomial infection, I suppose you know what is nosocomial. Nosocomial क्या होता है? Nosocomial means if a particular patient is being admitted for certain region, okay, and develop certain other things from the hospital environment, mostly that can be UTI, because for any reason that fellow will be catheterized. If that is prolonged catheterization, that will lead to what? The catheter associated UTI. So this should also be remembered. Now, other than that, what are the major differences? Here only I like to tell up between the lower UTI and the upper UTI. And I suppose now the sites and all is very clear to you, and it should be clear throughout the life now, I suppose so. The sites involved. What are the sites involved? Urethra and bladder for the lower UTI. And in the upper UTI, it is kidney and ureter. Is it fine? What are the various symptoms which you can look out in the case scenario? Here it is. Just told you frequency, dysuria, urgency. These are there. And you can remember like this FUD. Okay, somebody's fed up with the lower UTI. Fed up. So remember like that FUD, fed up, lower UTI. Frequency, dysuria, and urgency. Okay. Obviously, if you have to go again and again for urination and there is a urgency, there is difficulty also, definitely you will be fed up with that. So that is what is there. In the lower UTI, it is FUD. Whereas in the upper UTI, you have what? Fever, vomiting, abdominal pain. Okay, what is there? Fever, vomiting, abdominal pain, and you can safely termed as pyelonephritis. That is what is termed as pyelonephritis. Okay, so this is the term for the upper UTI. The pelvis, pyelonephritis. That is fever, vomiting, abdominal pain. This is upper UTI. Now, how does the infection happens in both of them? Obviously, one thing is common in them, that is the ascending route from down to up. Okay, in both of them, obviously. And in the upper UTI, it is hematogenous spread. So it can be from the blood going to the kidney. So descending route is also there in the upper UTI. Okay. Descending route is also there in the upper UTI. Otherwise, you know, guys, now every infection, how it will happen? It will enter through some meatus. So suppose somebody is involved in a sexual activity. Okay. And by chance the other fellow is having some infections and all. So obviously those bacteria will ascend. Okay. Urethra. They will resist various things and they will reach up to this bladder, or in the urethra itself they can do what? Urethritis and all. And that is what is termed as UTI. Okay. So this is one of the mechanisms by which they tend to do the infection. And a similar story for this also. That is ascending the same route, involved up in some procedure, catheterization and all. Okay. That bacteria is being introduced by the hospital ones. Okay. The same similar story for lower UTI also. So it can be either way. And the sexual ones and number of other factors over there, we will discuss them. And descending route, that is if the blood is only having infection and then blood is going to the kidneys, then the patient can land up with what? Pyelonephritis. So this is what is termed as the descending route. Okay, that is what is termed as the descending route. Which one is more common in the clinical practice? So obviously more common is lower UTI, upper UTI is less common. Okay, and it's good for also that upper UTI is less common because this is dangerous as compared to the lower UTI. Lower UTI is easily being treated. Okay, that is easily being treated. Fine. So are you getting? Okay, so this is there. Now, let's talk about the various factors which affect of the UTI. The various factors which affect of the UTI. Hi Dinesh. Hi Teja. So, what are the factors, guys? The factors are prevalence. We say that around 10% of the humans in their life they suffer from UTI. Okay, how much? 10% of the humans they suffer from UTI in their life. So if you ever had this, so around 10% of the human population, they tend to develop the UTI anytime in their life. Okay. The next important thing is gender. To which particular gender the UTI happens to be more. And on this, they can ask you the question in the Viva also. This is females more than males. Okay. Females more than males. And why is it so, guys? This is the question which they ask. Why is it so? So the thing is that the females, they have short urethra. Okay. They have short urethra, and there is a close proximity to the anus. Okay. There is a close proximity to what? To the anus. The opening of urethra is having a close proximity to what? To the anus. Fine. So these are the two reasons which we will tell in your exam that why the females they suffer more than the males. First is they have a short urethra. उनका urethra होता है छोटा, around 4 centimeters. And there is a close proximity of this urethral meatus to the anus. So from the perineal region, the bacteria can go and contaminate up, and they can ascend up like that to the urethra, and thereby does the lower UTI. Mostly. Okay. Now, if we talk about the ages, in the age factor, the males, they are affected in the extremes of ages, like in the childhood or in the old age. Okay, childhood or old age. Like in the childhood, why? Because of somebody is not changing the nappies and all. So that can be one of the ways by which this bacteria can ascend off the urinary tract and can cause the infection. In the old age, so that is like prostate enlargement in the males. That is one of the common reasons by which the infection might happen in the old age, along with the stones, along with any catheterization, if the fellow is admitted up in the hospital and all. So all these particular points are there regarding this particular ages. That is in the males, either in the childhood, that is there, and the old age. In the females, it is being said that yes, it can be in the childhood. Along with that, as the age increase, as age increase, there is a chance of the UTI that also gets increased. Okay, the chance of the UTI also gets increased as the age progresses. In the case of females, okay, means in the young age they have a high chance of having UTI. Now, another important factor is pregnancy. Okay. And you know, in pregnancy, what happens? A lot of anatomical and the hormonal changes happen in females. Okay. Because of some disruption in the anatomy, along with that, some hormonal changes, most of the pregnant females, they can suffer from what? UTI. Okay. Most of the pregnant females, they can suffer from what? UTI. And here only I like to tell you, in their UTI, it is mostly what? Asymptomatic bacteria. Okay, this word, I will tell you what it is later on. But remember, in the pregnancy, without any symptoms, there is a, in the urine, the bacteria they are coming off. So that is termed as asymptomatic bacteria, and you will consider this asymptomatic bacteria significant in the case of pregnancy. You will consider this as what? Significant in the case of pregnancy. You need to treat this, even though it is what? Asymptomatic. So this also might be asked in your exam, that in which condition we need to treat the asymptomatic bacteria also. The answer is in the pregnancy. Okay. In the pregnancy, you need to treat up the asymptomatic bacteria also. Is it fine, guys? Now, after that, the Fifth point is regarding the structural and functional abnormalities. Structural and functional abnormalities. So, what is the meaning of structural and functional abnormalities? The structural and functional abnormalities means what, guys? That in some structure or due to some function. Okay, how come? How does the structural abnormality happens? In the structural abnormality, it is due to some stones. Okay, it is due to some stones. Suppose some procedure is being done, and later on, because of that, stricture forms. Okay, so stones and stricture formation. That particular one associates with what? Structural abnormality. Then, what is the functional one? The functional one is there if there is a spinal cord injury and the person develops due to that injury what? Neurogenic bladder. Okay. So in some accident and all, if the person develop an injury to the spinal cord, so definitely can have what? Neurogenic bladder. Okay. This we already have talked about. If somebody is being admitted in the hospital and is being catheterized, and because of that only that COTI word have come, and you will like again and again listen out this word in your clinics, COTI. So catheter associated UTI. Okay, that is what is termed as what, guys? Catheter associated UTI. For any of the things, if you are being admitted in the hospital, you might need the catheter, urinary catheter, and that is a storehouse of what? Infections. And that's why it is also termed as what? One of the most common in fact, nosocomial infection worldwide. So that is termed as COTI. Then you have this bacterial virulence. Okay, not every E. coli is capable of doing the UTI. Okay, not every E. coli is capable of doing UTI. UTI is being done by a certain bacteria. Okay, which have what? P. fimbria with them. So P. fimbria is what, guys? This particular P. fimbria, you know, fimbria. Fimbria they use in attachment to the uroepithelial cells. So those particular bacteria which have P. fimbrias or they have mannose resistant fimbrias. These two words you should know. One is P. fimbria and one is mannose resistant fimbria. Mannose resistant fimbria. Okay. One is P. fimbria and one is mannose resistant fimbria. If this sort of a bacteria, P. fimbria, mannose resistant fimbria is there, that will do most of the cases of UTI. Because with the help of this fimbria, which is mannose resistant, they will attach. Where they will attach? To the uroepithelial cells. Where they will attach? To the uroepithelial cells. And thereby does what? UTI. So this is what is important regarding the bacterial virulence. Then comes this particular VUR. What is VUR? Vesico-ureteric reflex. In your first year, you must have heard of this vesico-ureteric reflex mechanism, a valve-like mechanisms. And sometimes this valve-like mechanism fails and thereby fails or weakens up. And because of that, the urine from the bladder can go upside to the kidney side. Okay, so that can also happen now because of this vesico-ureteric reflex. Vesico-ureteric reflex. Is it fine? So this is one of the points. VUR, valve mechanism, that particular one fails. And the most important is the genetic factors also. So genetic factors you can't ignore. They are there. Okay. Certain females, particularly females, they are more predisposed to get the UTI. Okay. Very clearly written in Harrison that certain females are there. They are more predisposed to get the UTI infection more. And interestingly, they say this thing also that if as a child they have a girl child, okay, that girl child is also predisposed to UTI. Means genetic stuff is also there. Okay, genetic stuff is also there. The genetic factors also plays a role in the UTI. Okay, genetic factors also play a role in the UTI. So again, if we revise up all the factors with one line, what are those? Prevalence. 10% of the humans, mostly they suffer from UTI throughout their life. 10% around. Gender, the female, no doubt, they are the front runners in it. And why they are the front runners? Because they have a short urethra and they have a close proximity to the anus of the urethral meatus. This is second point. Then age. In the males, it can be childhood or in the old age. Old age because of prostate or any other ailment, okay, which blocks, obstruct. In the childhood because of the napping change is not proper and all, or some VUR problem. So number of things are there. So in them they can happen. It is more common in males. In the females, as the age increases, means towards the puberty, there is an increase in the chances of UTI, 10 to 20% chance increase as per the age. Okay. As far as the pregnancy is concerned, pregnancy is an invitation for UTI. And in the pregnancy, asymptomatic bacteria mostly happens. Asymptomatic bacteria means symptoms will not be there. Okay, symptoms will not be there. So, what is important in the pregnancy? You should go for the urine examination. Okay, you should go for urine examination, and in that, if you observe bacteria are coming, okay, bacteria are coming, and your colony forming units are more than 10^5, and you are not having any symptoms. This is a clear cut of what? UTI case. Even though you don't have any features like burning micturition, dysuria, and all that, if you don't have, still you have to treat it. Otherwise, this can like enhance up or it can complicate the pregnancy. So it's better to treat this asymptomatic bacteria in the UTI. Obviously, it can be treated by various ways, which the doctor says by giving a Melcosol, or if at all it is more you are having features also, then you have need to take the antibiotics also. That also you have to see whether they are can be given in pregnancy or not. So all those particular things they are there, but important is if UTI is there means you will not see the features. But if the urine examination suggests that you're having UTI, then you need to treat it. Okay. Structural and functional abnormality, stones, along with the strictures. So that is one of the things which can contribute to the UTI, that is structural one. And functional one, suppose somebody have got a spinal cord injury, so neurogenic bladder will happen. So that is also an invitation for what? UTI. Another big invitation is catheter. Whenever you go to the hospital for any reason, they might put you a urinary catheter and all, and that is a storehouse of the infections. So that is what is termed as SCOTY. That is catheter associated UTI. Then you have bacterial virulence. In the bacterial virulence, certain fimbrias are there like P. fimbria or mannose resistant fimbria. If that type of a E. coli is there, if that type of a E. coli is there, that particular E. coli is virulent. Okay, every E. coli is not virulent. These which have P. fimbria and mannose resistant fimbria, they are more virulent. Then this VUR, vesico-ureteric reflex, if start happening up, okay, this reflex, not reflex, okay, reflux actually, vesico-ureteric reflux. So this one is from the bladder, the urine is going up. So that is what is there, termed as vesico-ureteric reflux. And the various genetic factors. Which all genetic factors? I told you, some females, they have a predisposition genetically more towards the UTI. They have a high chance of having UTI. And even their girl child, that is also having a high chance of having the UTI. I suppose now these particular factors are clear to you. Is it clear to you? You can tell up the live chat and you can write up regarding them. Okay. So important to write up in the professional exam is these headings should be remembered by you. Prevalence, gender, age, pregnancy, by any sort of mnemonic if you want, or any sort of understanding purpose and all. But these particular things should be able to be recalled in the exam. If you're able to recall of these things, you will like able to write up proper in the exam. Is it fine, guys? So these are to be remembered. Now, after this, if we talk about the various organisms in detail which can cause a UTI, so the spectrum lies from the bacteria, even to the fungus, even to the parasites, even to the viruses. Okay. Now, as the name suggests, in the gram-negative bacilli, the family which holds up the maximum cases is Enterobacteria. And in that, which one is most common? E. coli. Okay, there is no points in guessing that our favorite Escherichia coli is the most common. That is 70% of the cases of UTI they are done by which fellow? E. coli, that is Escherichia coli. Fine. Second one is Klebsiella. Klebsiella pneumoniae. I told you. And I just told you this also that these two fellows, they are lactose fermenters also. They are LFs. They are lactose fermenters also. Remember that. Enterobacter. Okay. Enterobacter, Proteus, Proteus, different species. They are also associated with what? With the UTI. And here only I like to tell her that this particular Proteus associates with triple phosphate stones, guys. Okay, triple phosphate stones. And why does it produce these triple phosphate stones, which are also termed as true white stones? Which are also termed as true white stones also? Because it produces a enzyme, and that enzyme is termed as what? Urease enzyme. Okay, and that makes the urinary tract alkaline and thereby precipitate these types of triple phosphate stones or steroid stones. Then our red color pigmented bacteria, Serratia, it produces a red pigment, if you remember, Serratia marcins. So that is also one of the bacterial agents which does the UTI. So they all belongs to which family, guys? Enterobacteriaceae. Then comes those which are termed as non-fermenters. Non-fermenters is what? The non-fermenters are those which does not ferment any sugar. Okay, which does not ferment any sugar. Pseudomonas aeruginosa. Okay, not samosa. Pseudomonas aeruginosa. Okay, another one is Acinetobacter. Okay, in your clinical practice, you will definitely hear about this particular bug named as Acinetobacter. Why will hear about this? Because this is one of the common ones in the where? In the ICU. Acinetobacter, it is found to be multi-drug resistant. So that is what is the story of Acinetobacter. The Acinetobacter species is also associated with causing a UTI sometimes. Gram-positive bacteria. I told you my mnemonic, McDonald's. So gram-positive bacteria, which one? Mycobacterium TB. That can also associate with this particular UTI. Remember, Mycobacterium as such is what? It is acid fast, 25% acid fast. Okay, but still, it is being considered gram-positive bacilli also. Is it fine, guys? So Mycobacterium TB is there, non-fermenters are there, Enterobacteriaceae members are there. They can associate with the UTI. The most important name which you need to know is E. coli. If you're not remembering everything, just remember at least one name, that is E. coli, which is the most common agent of the UTI, as per the bacteria also, overall also. Now, as far as the fungus is concerned, that is Candida. And which Candida, guys? Candida albicans. Okay, Candida albicans. Candida albicans can be a contaminant also. Remember that. So you have to relate up with the features. If the person is having features and in the urine you are getting the Candida E cells, so obviously that will be an infection of Candida only. Otherwise, it can be a contamination also. That also needs to be remembered. Parasites. In the parasites, Cystosoma hematobium. Okay, Cystosoma hematobium, which is a trematode. Is the one which associates with UTI. Okay, it can cause the UTI and even it can cause cancers also, guys. Cystosoma hematobium is one which leads to squamous cell carcinoma of urinary bladder. Okay, Trichomonas vaginalis, which leads to trichomoniasis and obviously associates with UTI also. Okay, so guys, in the last bit in this particular various agents, viruses also come. One is BK virus, and BK virus does not have the full form. What is BK? Nobody knows. Okay, so BK virus is actually a polyoma viridae member. Okay, BK virus, and this particular BK virus mostly does the problem in the post transplant patients. And this particular one associates with what, guys? BK nephropathy. BK nephropathy. And the adenovirus is also there, which number of adenoviruses are there, which can associate with the UTI. So as per the viruses are concerned, only two names you remember of. One is BK and one is adeno. As far as the parasites are concerned, Cystosoma hematobium, Trichomonas vaginalis. As far as the fungus is concerned, Candida albicans. And the major agents are bacteria, and the most common is whom? E. coli. The most common is whom? That is the E. coli. Is it fine, guys? Now, definitely the new curriculum which you have, in that you must be facing this difficulty. So how to find that which is a virus, which is a parasite, which is a fungus. So for this particular problem only, what we have in our DocTutorials MBBS curriculum map, I have given a full gist first, and then I have gone systemic. So first of all, you should know this, that you are dealing with a bacteria, you are dealing with the fungus, you are dealing with a parasite, or dealing with a virus. Okay, because I have seen up in the Viva, the students are confused that which virus we are talking about. They don't know DNA, RNA. Which parasite we are talking about, cystode, trematode, nematode, protozoa, what they are, which fungus they are. Is it a dimorphic fungus? Is it a subcutaneous fungus? It is superficial fungus. They don't know that. And the problem is there in that curriculum. No doubt the problem is there in the curriculum. I am with you in that. So the best way for that is first have a knowledge that which are the bacteria which can do which all things, then the fungus and all whatever you want to read up. And this I have done in my app, that MBBS UG curriculum app. What I have done, this particular thing I told you before, that which one is a bacteria and what it does. So if you see that 2-3 hours video first, then you will be so confident in dealing up with systems approach. And obviously this is like without doing it 2 or 3 times, you will not have much of the idea. But if you read it 2 or 3 times once, and after that you go to the systems, you will feel another confidence that this I know, that this is bacteria, this I know, this is parasite, this I know, this is fungus. So when you have that type of a confidence now, able to classify the things that this is this is this, then you will have a better understanding for sure. Okay. Now, as far as these features are concerned, lower UTI and all, I already told them. Asymptomatic bacteria comes into this, cystitis comes into this, urethritis comes into this, and there is a syndrome termed as acute urethral syndrome. So they all are features of what? Lower UTI. Okay. Upper UTI, I told you, pyelonephritis, urethritis, ureter inflammation, perinephric abscess in the area around the kidneys. They might be a perinephric abscess, renal abscess, renal TB. They can also associate with the upper UTI stuff. And there is an immunological sequelae of these particular UTI that is termed as post streptococcal glomerulonephritis. Okay, post streptococcal glomerulonephritis. That is one of the immunological sequelae of the UTI. Okay, the same was where with the streptococcal infection, the pathogens and all. So immunological sequelae of the UTI can be this. Post streptococcal glomerulonephritis can also be considered as one of the sequelae. Now, so these particular ones you should know. Asymptomatic bacteriuria comes in what? Lower UTI. Cystitis means bladder inflammation. Urethritis means urethral inflammation. Acute urethral syndrome is also there, which is common in females. And upper UTI is all about kidneys, perinephric abscess, renal abscess, renal TB, and this I told you, pyelonephritis. Now this one, ASB. I already talked about this. ASB is what, guys? Asymptomatic bacteria. What it is? Asymptomatic bacteria. And this asymptomatic bacteria means the patient have come just for the test, and in the urine examination suddenly you find that this is having more than 10 above 5 CFU per ml, okay, of the urine, this much colony forming units. So this is a clear cut indication that this particular fellow is having what? UTI. And just told you, as such, you can leave also, but in pregnancy this needs to be treated. Okay, this needs to be treated in the pregnancy. Which one? The ASB. What is ASB? Asymptomatic bacteria. So this also should be clear, and it comes in the low UTI stuff. As far as the cystitis is concerned, guys, you know cystitis is what? Infection of the bladder, inflammation in fact. Okay, and what is there? I told you this mnemonic, FUD, fed up with that. So frequency, urgency, dysuria. That is termed as the features of the cystitis. And along with that, above that bladder, suprapubic tenderness will also be there, obviously. Okay, the urine will be cloudy, and it is having what? Very bad odor coming from that. Okay, and no associated systemic manifestations will be there in the cystitis. So these are the features of the cystitis which you need to focus upon. As far as the acute urethral syndrome is concerned, okay, as far as the acute urethral syndrome is concerned, this is seen in the young sexually active females. Okay, sexually active females. And the classical features of this acute urethral syndrome, if at all the short note comes, they are of the lower UTI, as in the cystitis. And what is there without seeing, you can tell by the mnemonic: fed up, frequency, urgency, and dysuria. The bacterial count is not more than 10^5 as in the asymptomatic one. It is low. How much? This range. This is like that, not this 1 and 105. This 10^5. 10^2 to 10^5 CFU per ml. So bacterial count is less. Okay. In this particular one, the pus comes out, and that is termed as pyuria. Okay. So white urine you might find in this. And the agents are mostly due to the usual agents of UTI. The infection may happen means E. coli can be there and some others can also be there, like staph saprophyticus. That can also be there in the sexually active females, young age. That is one of the common agent. Okay. So few cases are done by this gram positive cocci. I just told you, no? Staph saprophyticus. Okay. So whenever in the question or in the clinical scenarios also, a female, young age, comes after the honeymoon to you, so must be having the honeymoon cystitis, that is the above one, or might be having a acute urethral syndrome in which a white urine sort of thing comes. And what is the meaning of that? That is the pus is coming. That is the pus is coming. And mostly it is done by whom? It is done by this fellow. Staph saprophyticus. Staph saprophyticus. Now, as far as the lab diagnosis of UTI is concerned, okay, so obviously the specimen collection should be there. Which sort of specimen should be taken for UTI? The answer is MSU. And what is MSU? Midstream urine sample. Okay, midstream urine sample should be taken. And what is the meaning of this midstream urine sample? The initial stream of the urine should be discarded. Midstream urine should be taken. So which particular urine is taken? Midstream. Clean catch, we call it. Okay. Obviously, after cleaning up of the proper genitals, then it should be taken. Okay. Now, after that, you can take the, you can do actually the suprapubic aspiration also. And that is directly from the bladder. That is termed as suprapubic aspiration. From there, you can have the urine from the directly from the bladder. And in the catheterized patients, okay, the urine is aspirated from where? From the catheter tube. After clamping, you have to clamp that. Where? Distally. You have to clamp that distally. And the urine in a catheterized patient should never be taken from where? From the urine bag. Okay, remember this. That should never be taken from where? From the urine bag. It should always be taken from where? Catheter tube. Another important stuff in the infection control which can be asked to you is this also. That in the catheterized patients, the urine is aspirated from where? From the catheter tube after clamping the catheter distally. And it should never be taken from where? From the urine bag. Okay. Now, then it has been transported and ideally it should be processed immediately. Okay. Otherwise, you are expecting the delay, refrigerate that. Or you add up what? Boric acid to that. Okay. You add up boric acid to that. Is it fine? So this is regarding the transportation of that. You should be able to like process that immediately. And if you are expecting the delay, then you have to refrigerate or put a boric acid. Now talking about the direct examination, first of all, you will go for the wet mouth examination. How to make a wet mouth examination? Take a slide, over that one drop of urine, over that you put a cover slip, see that under microscope. Okay. And what it can tell up, guys, it can tell the WBCs. Okay. It can tell you regarding the WBCs, it can tell number of other things also. Bacteria might be seen up. Okay. And obviously, whenever firstly the urine comes to you, you will see the outer appearance. It is cloudy. Okay, it is dirty, like odor is coming from that. Whether RBCs are there or not, blood is there in the urine or not. So all these you need to check on the very first thing whenever the urine comes to you for the processing. The pyuria that is being termed as more than 8 pulses per mm of cube is taken as significant. if you're finding in one of the wet ward examinations more than 8 pustules, that is significant. That is termed as pyuria. Along with that, guys, you have certain screening test also. Okay, guys, you have certain screening test also. And what is the meaning of screening test? Means they are initially being done. That's why they are termed as urine screening test. And one of them is leukocyte leukocyte esterase test. As you can see in the written also here, leukocyte esterase test. Okay. Then what else we can do, guys? Catalase test. And there is a test which is termed as grease nitrite test. These three names are there. At least these three names should come in your mind. That is the leukocyte esterase test, catalase test, and the grease nitrite test. What is the meaning of all this? That this leukocyte esterase test, it is a rapid and cheaper method that detects which particular enzymes, leukocyte esterase, which are secreted by which fellows? Pus cells. Okay, so that can be used for a screening of the things. Another one is nitrate reduction, and that is termed as grease nitrite test. And the E. coli give this particular test as positive. And another test which is being given positive by E. coli is catalase test. And what is catalase test? When you put up the colony or the urine and you put 3% H2O2, the bubbles will come. That is termed as catalase test. So these are the various screening tests whose name you should know. One is leukocyte esterase test, the catalase test, and the grease nitrite test. Number of others also there, but these at least three names you should come. So whenever this question came in the NEET PG also, that can be asked in your Viva also in the MBBS curriculum. And whenever you talk about them, okay, remember like that, that there is a cat. Okay, there is a cat whose name is what? Lucy. And this particular Lucy cat have made the grass wet, gila. Okay, as like this, you will remember it for lifetime. That there is a cat whose name is what? Lucy. It made the grass what? Gila. Gila means wet. Urine, UTI. This UTI screening test are these: leukocyte esterase, catalase, and grease nitrite test. These three names at least should come in your mind. Then, guys, you can go for the gram staining. Gram staining, you can see, you can comment upon after the gram staining that which bacteria are coming. Is it a cocci? Is it a bacilli? Mostly filled with the bacilli. Okay, that can be told by this gram staining. Now, talking about the culture media. Okay, culture media. In the culture media, what you should know? In the culture media, two important culture medias you should know. What is that? One is the McConkey agar. Okay, and one is the clade. One is the clade and one is the McConkey agar. So guys, what is McConkey agar and clade? These are three types of medias. What? They are differential, they are indicator, and they are selective also. Okay, McConkey agar I'm talking first. Differential, indicator, and selective. What is the meaning of differential? It differentiates between LF and LF. Which particular ones they ferment the lactose, which does not ferment the lactose, they are termed as NLF. Now, indicator. How does it indicate that? By the color change. They do the color change. Color change to what? Pink. Which fellows? Lactose fermenters. And why we call them selective? They are moderately selective actually. And because they allow the GNB to grow, they allow the gram-negative bacteria to grow. So that's why they are selective. McConkey agar is that sort of a bacteria. So McConkey agar is a bacteria which is differential. Differential in what sort, guys? Differential in this particular sort, that is differential between LF and NLF. It is indicator. Indicator means color change. Color change to pink. Selective, the GNBs are only allowed to grow. No other is allowed to grow. And that's why we say the clade is a better media than the McConkey agar. Why? Because it is differential, it is indicator, but it is non-selective. It allows the candida also to grow. It allows other fellows also to grow. And that is what is the logic of this one. non-selectiveness, why the clade is preferred. Now you will say, what is clade, sir? The clade is cysteine lactose electrolyte deficient media. Cysteine lactose electrolyte deficient media, that is termed as clade. This is what is termed as clade. Okay, guys. So this name very important. You should know. And this particular one is a green color media. Green color media. It is green, which changes to yellow. Okay, which changes to yellow when which fellows they grow? Lactose fermenters. Which fellows they grow in that? Lactose fermenters. And which are the lactose fermenters? E. coli and Klebsiella. Okay, E. coli and Klebsiella. Is it fine, guys? Now, this particular thing, I think you understand this. Now, after putting up the urine sample over these agars, culture medias, you come to the lab next day. And what you observe? You observe the colonies. Okay, you observe the colonies. And if on a culture plate you are seeing a lot of colonies, okay, so here comes this cause concept of significant bacteria. What is that? It says that if a person is having more than 10^5 CFU per ml, okay, means this much of colonies, it is there on the culture plate, more than 10^5 CFU per ml, the calculation comes. That means it is significant bacteria. Okay, significant bacteria means even though the patient is not having features, you need to treat it. Okay, and that is termed as CAS concept. Okay, more than 10^5 is significant, and that's why the name have come, na, significant bacteria. And based on this fact only, why is it so? Why we say so? Because normal urine is sterile. Okay, so normal urine normally is sterile, but it can get contaminated during voiding with the normal urethral flora. Okay, normal urethral flora is E. coli. Okay, it can come in urine. There is no problem. But if it is coming more than 10^5, then it is a problem, na guys. This is what is the logic. Okay, this much count is a problem. Bacteria can come in the urine. That is not a problem. But if this much they are coming in the urine culture and they are voiding up in the urine also, as such only you can see under the gram staining and all of that particular one, then it is a problem. That is termed as significant bacteria. And the cause have given this concept that we need to treat it. Okay. The quantitative cultures. This is which I'm telling now, this CFU and panel. This is termed as quantitative cultures also. What is that? You count the number of colonies. I told you. Okay. So next day when you go to the lab, you count the colonies. And there is a factor. Okay. That factor is by calculations or the loop. Okay. For that, that particular calculation comes into action and you count up the colonies, and according to that you give the report that it is more than 10^5, more than 10^4, or more than 10^3, what it is. Okay, so that is termed as quantitative cultures. Each colony on the plate corresponds to one bacterium in the urine sample, like that it is. Okay, and this particular quantitation means this numbering can be done by semi-quantitative methods and the quantitative methods. Semi-quantitative method is, I just told you, standardized loop we use now for inoculation of the urine on the culture plate. So that is termed as standardized loop technique. And the quantitative is pour plate method, which nobody does now. Okay, which nobody does now. As far as the colony appearance is concerned, we already have talked about. It depends on the organism grown on the McConkey agar. I told you just now. And in the McConkey agar, E. coli and Klebsiella, these two fellows, E. coli and Klebsiella, what they produce, guys? Lactose fermenter colonies. And what is lactose fermenter color? Pinkish. On which media? McConkey agar. Okay. And the non-lactose fermenters, important ones are which one? Proteus, Pseudomonas, Acinetobacter. They produce what, guys? Non-lactose fermenting colonies. Means they will not be pink. Okay, they will not be pink. And nowadays, what we have automated methods also for the automation identification systems. They are also available, such as Vitek, Vitek 2. These all are also available. Along with that, we have the various biochemical tests also, which we now don't do, the conventional ones. That is IMVIC reactions. What is IMVIC reactions? Just the name, indole, methyl red, Voges proscure, citrate. which is for the E. coli is plus plus minus minus. Means E. coli is indole positive, methyl red positive, Voges proscion negative, citrate negative. That is the story of E. coli. And Klebsiella is just opposite of that. This is E. coli and the Klebsiella is minus minus plus plus minus minus plus plus. That is the Klebsiella. Okay, guys. So in short, which I like to tell you, if the culture medias you need to write two names. One is meconic agar, one is clade. Which one is better? The clade is better. Why the clade is better? Because it is non-selective. It allows every other bacteria also to grow on that particular culture plate. That's why we preferred clade over the meconic agar. Okay. And the clade is which color media? Green color media. Changes to yellow whenever these fellows they grow. Which one? E. coli and Klebsiella. So E. coli Klebsiella can grow on meconic also. They can grow on the clade also. Which one is preferred? Clade. Because it allows the gram-positive cocci also to grow, candida also to grow. And this is an important question for the MCQ also. That why the clade is preferred over this? Which one? Meconic agar, because it is non-selective. I suppose now you have got my point. Okay. Now, as far as the treatment of UTI is concerned, guys, it is based on the antibiotic testing report. Okay. In India, doing a culture for any of the samples is not in culture. So that is the problem of India. And because of that, what is increasing? Antibiotic resistance. So this antibiotic resistance should not increase much. So as a clinician, a future clinician, what are you going to take up? Please have this habit that you should send the sample for culture. Then only you will get the correct antibiotic to be given. Otherwise, as a clinician, as an MBBS fellow also, you are contributing to what? Antibiotic resistance. And you know, antibiotic testing is being done by which method, guys? This should be known to every MBBS curriculum fellow. KBDDT. What is KBDDT? Kirby-Boyer disk diffusion testing. Okay, Kirby-Boyer disk diffusion testing. This is the name of the method. Okay. On this KBDDT, this method is done on which media? It is preferred to be done on MHA agar. Another practical question of yours. It is done on which media? MHA, Mullal Hinton agar. If Mullal Hinton agar is not there, then what? Nutrient agar. That will be available. This is also a MCQ of the practical. That if the Muller Hinton agar is not there, on which other media we can do this carbohydrate diffusion? Nutrient agar. Is it fine, guys? So I suppose, and based on that, you should see the zone of inhibitions and you give the required antibiotics. Which are the preferred antibiotics? You can give the quinolones, norfloxacin, ciprofloxacin that can be given, nitrofurantoin, cephalosporins, aminoglycosides. These all can be given. These all can be given. Okay. And in the practice, this is a wonderful drug. I'm telling you here itself, if any of your relatives develops up, you can also flaunt and give the nitrofurantoin for the UTI. It will work wonders. But obviously, not directly you should give. It should be after the antibiotic sensitivity testing. But otherwise, I'm telling you which drug is having the highest sensitivity, nitrofurantoin. No doubt in that. It is like a magic drug for this. Along with that, the alkazol and all that you should give, the patient will be okay in 3 to 4 days itself. And that is a big thing for this. And if it is a hospital acquired one, nosocomial stuff with the MDR one, then you can need carbapenems also like meropenem. And along with that, you should have this combination of beta-lactam along with beta-lactam inhibitor combination like piperacillin, tazobactam, and fosfomycin and all. They can also be used in the treatment of the UTI. Okay. Important here is that this can also be asked in your viva. COTI, catheter-associated UTI. If a person is admitted in the hospital, you put a catheter and you take the urine. I just told you where you will take a urine from the catheter one. Tell me. Yes, try. You will take the urine from the tube, not from the bag. Never take from the bag. Bag is already contaminated. In that, the problem will come. So from where you should take? From the tube. So in this, if the counts, they come even more than 10 about 3 CFU per ml of urine, that is considered as what, guys? Significant. That is considered as what, guys? Significant. So this question can also be asked in your viva. that what is COTI. The COTI is more than 10 about 3 CFU per ml. If you are getting up, that is also termed as significant. You have to treat the patient. You have to treat the patient for the UTI. Is it fine, guys? And how to remember this three? This three, which is the third alphabet. C is the third alphabet. Okay. So remember like this, in the COTI it is more than 10 over 3. So these types of upset associations, they definitely help up. Do make them a lot in your studies of the micro, because micro is like slight bit factual. Okay. Along with the understanding stuff also, I have told you the basic understanding what is upper UTI, what is lower UTI. So in this particular one, whenever this question comes, you should importantly remember the three features. That is FUD, fed up with that, frequency, urgency, dysuria. That is should be known. There is a term which is termed as upper UTI also. That also should be in mind. What are the factors which play the role? That I told you. Which sex is affected more? Females. Why? Short urethra, proximity. Okay. And along with that, these two media names. Which one? McConkie agar and CLED. Which is preferred? CLED. Why? Because CLED is a non-selective media. CLED is a non-selective media. And the treatment I told you, nitrofurantoin, quinolones, cephalosporins, aminoglycosides, number of them are there. Even in some cases on hospital one, you can use carbapenems also. So guys, this is an overview of UTI for you. Definitely revise it once. You will feel more confident in that. Important is the names, these particular names, and along with that, these particular factors. Whenever this question comes, you should be able to tell the difference between them, ascending and descending stuffs, that which one associates with what, lower UTI is what, upper UTI is what. And this case scenario, which I told you in this, like that, definitely you will get in your exam. So this is one of the questions which definitely you will owe to get in your exam. Revise this proper. Thank you so much. And if you have any confusions and all, then you can ask me in the tutorial group. Along with that, you can ask me on my Instagram also. That is there, which is by my name only, Sonu Panwar. So there also you can ask any doubt and all if you have. And important is, I told you, that is the organism, you should know what it is. And how you know that organism? You will know by having that app of ours. That is the MBBS curriculum app for the second year. That is there. In that, if you see those particular 3 hours now, I'm challenging that you will able to recall up most of the things wonderfully well, because you will be well aware that which bacteria you are talking about, which parasite you are talking about, which virus we are talking about, and which particular parasites or fungus we are talking about. Okay. So that should be known first to you. If you have that confidence now that I know that yes, cystosoma is a trematode, then you see the magic. Then you will feel so much confident about the various infective syndromes and all. Okay, guys. So see you. Bye bye. Good night.
Recording stopped.